Hey guys, how are you? It's Ken Frucci from Corporate Medical Emergency Training, your safety compliance company. And I am your compliance officer for your HIPAA, for your DSO, and also if you work for a medical company, urgent care chain, or any other type of medical corporate chain, we are your compliance officers handling all of your compliance training. This short video is another virtual course that you guys are all required to have. And basically what it is just going over the PPE requirements that you usually are practicing day in and day out as part of your jobs. I typically like to do a lecture and keep it very basic, but I am going to show you an additional video that we have, which is a YouTube video. Some of the videos on YouTube I find can be educational, and all we're going to do when I'm talking with you just for a few minutes, going over a couple of PPE items, is to play that for you because it's good reinforcement to help you remember when we don and put our PPE on, it has to go on correctly. We have to wear it properly. You'll be learning more about that as you have your respiratory fit test done, which we're going to be setting up here shortly with your offices. Some of the offices have already scheduled that fit test. That is mandatory. We have to come in and do an actual live fit test on an N95 respirator. So that video will be nice for you because it'll just be a quick reinforcement. I do want to make mention of another type of mask that a lot of people are wearing, which is called the KN95. The KN95 is not a respirator. It does have a filter in it. The issue that we do have with some K95s is that it's thinner. It's not as thick, so it could be easier for the worker to wear it and breathe in it. But an N95 has two straps. A KN95 has one strap. So the two straps are going to make the mask seal better. It's all about getting the straps up high enough to pull the mask back and give you the proper seal, which is what we're looking for. And that's why it's really, really important that we have that available. But a KN95 is acceptable. But in higher risk environments, you really want to maybe consider wearing the N95. So that is exactly another type of PPE. And the only other kind of respirator, which is considered to be PPE today, is what we call the face. It's actually, some people call it an air purifying respirator. It's actually a partial face fit respirator. A full purifying respirator comes all the way down and looks basically like a welding helmet, which is what you typically see firefighters wear, which is known as a breathing apparatus. But these are small cartridge-based respirators that people need to be wearing if they're in a high-risk environment. Some of your safety data sheets with your chemicals that you have on them, when you pull those sheets up and you read the chemicals and the PPE section on there, some manufacturers will recommend that you do wear an actual face filtering or a partial purifying respirator with cartridges because the chemical you're working with can give up off of a vapor. That's more applicable to people that work in hygiene, industrial hygiene areas, definitely more applicable to people that are working in dental laboratories where they're doing a lot of drilling and a lot of the cosmetics. Sometimes when they drill the models and trim them, the white dust that comes off of that is known as silica dust. And we need to have cartridge-based respirators for these people. And when COVID first hit, we were doing a lot of this respirator fit testing for dental labs because they had that exposure for when patients have the models made. I was in an office not long ago doing an OSHA inspection, and I noticed that they had 3 boxes out up on the cabinet area, and it was in their laboratory. And I believe one was pumice. There was another white powder. You're probably more familiar with those powders than me, but they were in an open container where that powder was actually getting released, and people could be walking in that area and possibly breathe that into their lungs. So we made a recommendation as part of what we do when we do OSHA inspections is to put those powders or containers with the dust type material, pumice and everything else that they've had, in closable containers, and make that room a respiratory protection room where they need to be in at least level 3 and 95s, if not one of these types of respirators, because that is, again, airborne. Those chemicals or those particles can be released into the air, and they can be actually brought into somebody's respiratory system. So that just kind of brings up points about how it's so important that we literally always evaluate our risk, find out what is it that we do that could put us at risk. So, and we had another office I was at recently where a worker who was a hygienist actually said that she was going to refuse to wear an N95 or even a KN95, and it was actually the employer's policy that they be in an N95 when they're sterilizing. They're setting up, not so much setting up the rooms, breaking it down after and then sterilizing and doing direct patient care. So we want you, as always, with all the programs that we do for you, we are wanting you to always check with your HR department, find out from them specifically, is it a mandate? Are we supposed to be in N95s? Can we wear a level 3 surgical mask, or possibly even a level 2 surgical mask? Could we be fitted with one of these with what we call a smoke test, which is what we do when we evaluate you to see how well you could be fit with masks? Can we wear a level 2, level 3 and a face shield? That's another option. And you're going to see that in this video, that they will make mention for people who cannot wear N95 respirators, consider using a level 3 surgical mask and a face shield. And while that's acceptable under State Department of Labor OSHA standards and federal national OSHA standards, it may not be applicable to where you're working. We want you to make sure you check with your employer first. We want to make sure that we're not telling you to do something that your employer does not wish you to do. So that responsibility is on you, but we're here to advise you and help you. And if you ever have any issues there and you're not sure, by all means, we're here to help you, and you can reach out to me by email or phone call, and I can verify what we're telling you is what the HR department is asking you to do. You all should all know your facilities coordinator as well, who is our director of facilities, who I work with very closely. Annette Martino, she is in the corporate office of your DSO in Great Neck. And any other medical or dental that you may work in, you need to know who that coordinator is and that director, because communication goes a long way. We can prevent a lot of workplace illnesses and accidents by doing the proper training and making sure that everybody is on the same page. We don't want someone to be in a situation where they say, well, I didn't know, and now they've been exposed to something. And that's now our job at corporate medical emergency training, to come in and remedy what happened, document it, investigate it, come in, make those recommended changes, with hopes that we're keeping inspectors out and that we're not creating an OSHA incident or a violation. So please always check and practice that. But I'm going to now actually just put on this little video that I have. It's actually on YouTube. I like it because it's short and sweet, and it just goes directly into how to don and doff your PPE when you're walking into clinical situations or you're even sterilizing and working with chemicals. It's all about just kind of reviewing what you should be doing. So I'm going to step out of the picture for a few minutes and we're going to play this. And then you guys will actually have a chance to get a quick review. This is actually nice and sweet, and you can view this on your own YouTube if you want to on your own computer as well.
The COVID-19 pandemic has affected many areas of the dental industry. As surgeries begin to reopen, we want to walk you through all the safety measures that should be followed under both normal circumstances and the additional measures now needed due to COVID-19. Firstly, before a patient arrives at the dental surgery, they should be triaged remotely and have an appointment in place. If a patient arrives without a pre-booked appointment or hasn't been triaged, a procedure must be in place for all staff and patients to follow. Any patients who are showing COVID symptoms should be referred to a designated dental facility with a dedicated COVID path and a well-ventilated room. It's important to remember that the virus spreads via 3 main types of transmission: contact, droplet, and possibly airborne. So it's crucial that PPE is worn by all staff members when treating patients. Let's look at the PPE that should be used by dental staff. N95, P2 or FFP2 respirator masks that will protect against particles found in the air and should be worn when assessing or managing a COVID-19 confirmed case. If a respirator mask is not available, a surgical mask with a shield can be used. Goggles or face shields to prevent virus exposure. Long-sleeved, non-sterile, water-resistant gowns must be used to prevent body contamination. Gloves must be worn and extended to cover the wrist over the gown's cuffs. And importantly, patients must wear eye protection once in the dental chair. Let's rewind. We're going to take a look at the process you should follow for putting on and removing PPE. When putting on and removing the PPE, there are accepted sequences for how this should be conducted within a dentist surgery environment. The process of putting PPE on is called donning. Step 1. Perform hand hygiene by washing hands or using an alcohol-based hand rub. Step 2. Don the gown first. When using a gown with back closure, a second operator should assist in securing the back. Step 3. Apply the respirator. Perform fit test and seal check to ensure the mask is secure and tight with a comfortable fit. Step 4. Eye protection must be worn. Use goggles or a face shield and ensure the elastic fits snug on the head. Step 5. Perform hand hygiene before putting on gloves. Finally, Step 6. Don gloves and ensure they cover the wrist over the gown cuffs. When removing PPE, the process is called doffing. Step 1. Remove the outside of the glove with the opposite gloved hand and peel off. Keep hold of the removed glove in your gloved hand and slide your fingers off your ungloved hand under the remaining glove at the wrist. Peel the glove off over the first glove and discard both gloves in a waste container. Make sure to clean hands before moving on to the next steps. Step 2. Remove the face shield and goggles. The ties or elastic used to secure the equipment to the head are considered safe and can be removed with bare hands. Place in designated receptacles for reprocessing or in a waste container. Step 3. Remove the protective clothing by unfastening and pulling away from neck and shoulders. Do not touch the front and sleeves. These are contaminated. Turn them inside out and fold or roll into a bundle to discard or reprocess. Step 4. Remember the front of the mask is contaminated. Hold by the ties or elastic to remove it, then discard it in the waste bin. Step 5. Perform hand hygiene. When wearing PPE, you must be aware of the key points to remember. PPE must be donned correctly before you enter the patient area and must remain in place and be worn correctly for the duration of work. No PPE should be adjusted during patient care, and when removed, it must be done slowly in the correct sequence that prevents self-contamination. Perform hand hygiene before donning and after removing gloves. You must ensure that waste management is performed safely and is in accordance with local regulations. Thank you for listening and following the steps to make your dental surgery as safe as possible. Please get in touch with us for more information.
All right, guys, so we should be done. And that should be a nice quick review for you guys. Just to remember follow those policies that we have for you. And as always, if you have any questions, feel free to reach out to me, Ken Frucci. I am the Director of Dental and Medical Compliance for medical organizations and dental service organizations. You can reach me at kf1104@icloud.com. Feel free to give me a call. My direct number is 917-439-7338. And we're here to help you. We're here to keep you safe and help you make sure that you don't have any exposures. And if you do, we're here to help you with that as well. So once you complete this course, as well as all the other virtual courses that we're setting up for you in your learning management system, I'm in charge of going in and verifying who's done training and who hasn't, and then we'll be issuing those certificates for you. We are a National Academy of General Dentistry continuing education provider for the dental industry, and our programs are also accepted nationally for medical organizations. So we'll handle that, and you'll be able to get your continuing education credit. So thanks again, guys, for watching. The next two videos that you'll need to watch actually are the last two that we are developing currently, and that is the sexual harassment training, as well as an additional training we've set up, which is the employee alcohol and drug abuse program, so that we can let you know should you need help with anything in that area known as the employee assistance. That is all set up through your HR department as well. So until we meet again, thanks again, guys, and continue to stay safe. Stay safe. Thanks.